When we came back after the war, uh, the development of antibiotics had gone beyond the sulphur drugs to the penicillin group. The sulphur drugs only inhibited the growth of the bacteria, whereas the penicillin group that came later actually killed the organism. And as a resident, which I was for a couple of years, it was quite exciting for us to have to learn all of these new drugs and what they could do, and how we were tempted to overdo them. But at that time, there was plenty of instruction came out to us, advising us not to overdo it, because the organisms would become resistant to the treatment. The drill was that we had the option, or the instruction was that we should go through the procedure of having a culture done to find out what the organism was, and then sensitivities done to find out what antibiotics the organism was sensitive to. And that delayed the commencement of treatment for several days. Now, obviously, I was going to say the cowboys among us would start the treatment before that. And the technique that I personally developed was that the sort of conditions that required treatment were often in an epidemic form, and you'd see a number of cases and you'd sort of recognise them for what they were.